and the head of the radius, ulnar, and it's the olecranon process and the trochlear notch. So those would be what you need to know for that. The hand.
Oh, sorry.
What makes up your wrist are your carpal bones, and there's 8 of them in each hand. So that's why the carpus wrist, I put 16. Just realize that you might want to put in parentheses, there should be 8 in each hand. So if I have a sticker here, you would say these are your carpal bones. I'm not going to have you name them. So if you look at the next page, there should be a hand there. They do have names. Hamate, capitate, pisiform. I'm not going to have you name them. So if you see a sticker here, just know those are your carpal bones, and there are 8 of them here. This is the palm of your hand. These are your metacarpals. These are your metacarpals. So there are 5 of them. See, the metacarpals. Okay?
That's a palm, or
That's the palm.
so it'd be like this
In
side.
here.
Oh, okay,
This
the
way.
top
In here.
side. Okay.
Well,
Oh.
it's on either side,
Oh, okay.
This fine?
right? See,
Yeah.
if you look from
Yeah,
here,
yeah,
you can
exactly. That's
see
what I was
it.
wondering. If
Yeah,
it's a palm.
it's the palm.
And the finger?
These are your fingers. These are your phalanges. Now, for the phalanges, there are 3 parts to all of the phalanges except for the thumb. So the thumb just has, remember at the very tip is what? Distal. Distal and proximal. So that's your thumb. Distal and proximal. All the other phalanges have 3 parts to them. See, the distal, medial, or middle, one with distal, middle, and proximal. So distal, middle, and proximal, distal, middle, and proximal, distal, middle, and proximal. Even your pinky, here's the pinky, distal, middle, and proximal. So 3 times 4 is what? 12 plus 2 is 14. So that's why for the phalanges, I say 28.
thumb
It's
don't have needle.
Hand.
14 per hand.
Distal and
So
proximal.
again, phalanges, proximal, middle, and distal in the fingers, proximal and distal in the thumb.
Is that why we only have a certain set of lines like that?
Right. So you have less in the thumb.
Yeah.
And then you might say, well, how come the thumb doesn't have 3 rather than 2? If you have just the 2, the thumb is what we use for grasping. It's more flexible than the other fingers. So that's why.
Really?
Okay, so that's where I get 28. There's 14 in each hand.
Why do some people not consider the thumb like a finger?
The what?
Why do some people they don't consider the thumb as like a finger or something? Is it because it's not connected to the rest of your?
Again, when you're dealing with especially people who study primates, they think of them as they think of fingers, and then they say opposable finger,
things.
but it's
Wow.
it's still a finger, yeah. But it has more
Flexibility.
function.
Cool.
Okay, so we'll come back to the skull. 'Cause I don't know where they put our skulls. We'll come back to it. So. But that's odd, because we're supposed to have them. I'll have to find, I'll look through the boxes, yeah, because last semester I taught this, we had skulls all over the place.
No, the like the same
Sleep, I
bones
fell
and all
asleep
that,
here.
and they were on the next left too.
Right.
Because so
That's a skull.
might be
Graduate
So he may
they
have
put somewhere else.
put them somewhere else, yeah.
I think so.
All right, well, I'll try to hunt them down.
Use my hand.
To cut you open. All right, so we'll come back to that. Okay, so the lower extremities. Let's turn the page. The pelvic girdle, there are your 2 coccyx there. So here's the pelvic girdle intact, and this one's real also.
No.
So here are your 2 coccyx intact. So, and I brought this over, which is also real. It could be like this.
It's one side.
It's one side, right, so, here it is.
And so
Well,
it's like
it's
the hip bone.
Yeah, these are the hip bones, right. So if I say put your hands on your hips, you're touching the ilium, which is the largest, so that's the ilium, so that's your hip bone. So if I have a sticker here or here, that's the ilium. Then, do you see that your person, oh, it's broken on that side,
No.
okay. The person is sitting here. So when you sit on something, here and here, that's your ischium. So this, below this big projection socket here is the ischium. So this is the ilium, this is the ischium. Then you're going to have the acetabulum. I'll show that first. This big socket, that's going to accept the head of the femur. So you have the ilium, the ischium, the acetabulum. Then in the front here, like above the acetabulum, that's the pubis. So it would be here. This is the pubis. Pubis. Now, in a live person, do you see where this cotton is? That would be cartilage. That's your pubic symphysis. That is very sensitive to oxytocin. Remember, oxytocin is the hormone that helps with childbirth and delivery. So when a woman is getting ready to give birth, the oxytocin causes the pubic symphysis to thicken, and it opens the pelvis up a little bit, and that helps with the making room for the head of the baby, so to speak. So I could have the coxae like this attached, or I could have them separate. So again, if they're separate, the big piece is the what? Ilium. This acetabulum. What is this? Ischium, and then the one that comes to the front is the
pubic
pubis.
symphysis.
No, the pubis.
Pubis.
The cartilage is the pubic symphysis, but the bone, see, the bone is the pubis that forms the joint with the other pubis bone. The pubic symphysis is the cartilage between them. Okay, so I think they have them here separate. And then I'm not going to test you on this, but in case you're curious, you ever wonder how they could tell if it's a male or female skeleton that they find forensically? It's the shape and size of the pelvic bones. Yeah, it's the angle of the pubic arch. See, females have a greater angle, males have a shorter angle. Okay, and the brim, the pelvic brim, is a little bit thicker on the female than on the male. So it gives you a little, if you're curious, it gives you a little difference between them. Okay, now the femur is part of the thigh, but you might say, well, why does she have 4 there? We only have 2 femurs. Well, the femur, which is this, comes with this. What is this? The patella. Okay. So that's why they put it, since the patella attaches to the femur, that's why we say 4. So there are 2 femur, 2 patellae, okay? So the patella is the kneecap. So if you see something that looks like this, it's kind of triangular, it's all by itself. We have several of them by themselves.
Just a rock.
That would be the patella, okay? Not the kneecap, the patella.
It's like a little rock. Your kneecap, right?
Oh,
Like
absolutely.
a little
It's
rock
just
just sitting there.
Just
like a
sitting
little
there, you have a lot of
yeah.
cartilage. If
Pillow.
you break the cartilage,
Not
it
walking.
can break or dislocate.
That's part
See,
of my
there it
name
is
in
right
it.
there.
Huh?
That's the patella.
Oh. So now you know.
Exactly.
That's why.
It's not that big.
Ninja from
No.
leg.
Now for the femur, I think you can't mistake the head. See, the head on the humerus was, not the most
Humerus.
pronounced, right? The head on the humerus is not the most pronounced. That's the head. But the head on the femur, this is what they use to get the femur, right? They clonked you over the head. So here's your femur. Now, do you remember on the humerus there were the greater and lesser tubercles? They're not called tubercles on the femur. They're called trochanters. So I think you can definitely see the difference. This is huge. This is the greater trochanter. See this little piece here? This is the lesser trochanter. So don't say tubercles. Tubercles are for the femur. I'm sorry, for the humerus. Trochanters are for the femur. So again, they also attach, you know, here it's the thigh and gluteal muscles. Okay, the shaft is the same. Whoop.
Don't break
That's
that
okay.
bone.
The shaft is the same, it's the long part. And the same thing for the epicondyle. So again, if this is the head, this is going to be the medial epicondyle, this is the lateral epicondyle. So the medial is always in line with the head of the bone. Okay, so it's the head. What is this?
The
Greater
Greater
trochanter,
lesser
lesser
trochanter,
trochanter,
shaft,
Medial.
and
lateral.
lateral. Okay, very good. Okay, and then of course the patella. Okay, for the foreleg, we have, okay, I have the fibula. That's the long, slender bone. It does not bear weight, does not articulate with the knee, but it does support the ankle. So that's this bone right here. So that long, skinny bone is the fibula. And then I'll have to pull. I didn't get it. I'll go pull one. This medial bone is the tibia. It's your shin bone. Sometimes they call it the shin bone. That does form a connection with the knee. So that's the weight-bearing bone. So in the leg, you have just two weight-bearing bones. You have the femur and the tibia. The fibula is just kind of there to support the ankle. Okay, so it's not weight-bearing. So for those two, just to identify them, and I'll put one in a moment. The tibia is the thicker shin bone, and the fibula is the thin, long, slender bone. Now, for the foot, we have similarities with the hands. These, however, are called tarsal bones, not carpal. Tarsal is in the foot, and if you turn the page, you see the tarsal bones. Now, they also have names. I'm holding you responsible for two of them, and you can see them on the diagram there. So, see this big one in the back here? That's the calcaneus. That's your heel bone. So, you see the calcaneus? And then see the bone resting on top here? That's your talus. That's your ankle bone. So the talus, if I have a sticker here, you would say talus. If I have a sticker here, calcaneus. But if I have stickers here, what would you say? Tarsal
Tarsal
bones. You
bones.
don't have to worry about the names. The sole of your foot has the five. Now here they won't be called metacarpals. They'll be called metatarsals.
Tarsals.
So just metatarsals. And the toes are similar to the fingers. There's 14 here as well. Your big toe only has two. It has the distal phalange and the
Proximal.
phalange. So again, with primates, they use their big toes like their thumbs for grasping. So that's why there's only two. Your other toes, even your little baby toe here, have three. So there's distal, middle, and
Proximal.
proximal. Distal, middle, and proximal. Distal, middle, proximals. Distal, middle, proximal. So those are the phalanges, and then just distal and proximal for the big toe. Okay, so that is your foot. Okay, so why don't you get some boxes of bones. I will put these